of all patients.
In the first study,
I
we observed that
we
the
now
substrate
are
is
in
negative.
the era.
Why would you give Kuvan and not simply PAH to patients orally?
Well, first of all, Kuvan is a registered medication. These are pills which you take orally. And PAH is a protein which is not commercially available, would need to be first isolated as a protein. It's very unstable once isolated, so it's absolutely impossible to give directly PAH.
Okay. And are there any disadvantages to the way it's given now?
The disadvantages, the BH4 Kuvan is given now. The only one that I am aware is that only a pill of 100 milligram is available. It's not really practical for babies, for very small children. In the US, there is formulation of 10 milligrams available as a powder. So to my point, this is only a disadvantage right now.
Yeah, what would you see as the best development in this atmosphere?
The best development would be, of course, to find another treatment options, because Kuvan can be used only in some of PKU patients, not all of them, only to those who respond to administration of BH4 by lowering blood phenylalanine levels and increasing the tolerance for dietary phenylalanine. So the more severe classical PKU patients cannot use Kuvan. This is the biggest disadvantage right now. And if we would have a medication for everyone, that would be the perfect development in this field, I believe.
And how big a challenge would that be at this moment?
The challenge would be that medication or whatever is developed would need to act even in the inactive enzyme, which is the case in some of the patients. In another way, we would need to replace the inactive enzyme in these patients with the active one by giving whatever the form is, like PAH, but in the form that can be used stable and active for all of the patients.
And are you approaching that point?
Not myself, but there are developments in the field. A couple of research groups are working on this to develop so-called enzyme replacement therapy or enzyme substitution therapy by giving either phenylalanine, the protein, but in the form which is stabilized, chemically stabilized, or another enzymes which can also degrade phenylalanine in the body.
So to conclude, what are the perspectives of working with so-called gene therapy?
This is what I already mentioned. The enzyme substitution therapy or replacement therapy is a sort of gene therapy. So you need to deliver the enzyme either as a pure enzyme encapsulated orally, or you have to use a gene transfer using viral vectors. Sounds a little bit complicated. You use virus, which are no dangerous for the normal person. These viruses are inactivated, but they can transfer the protein which is missing to the body in the patient. This is still in development. There are a couple of groups working on this. We unfortunately still don't know how safe this is. We know that gene therapy using these viral vectors were reported in other diseases, not in PKU, to cause some severe side effects like cancer. Development today are at a stage that they are more safe, so we don't have these side effects, but it's still experimental working with the animal models.
Yeah, but apart from these possible risks, could this be a breakthrough technology, according to you?
Yes. If we can show that this therapy is really safe, and from my point of view, to show that a therapy like this, a new therapy, is safe, you will need to follow at least one single patient from the birth to the death.
That takes a lot of time.
Because when we talk about the safety, we can talk about the short-term safety and long-term. And long-term safety could be 10, 20, 30 years. We don't know.
Thank you so much.